So, good day everyone. I'm Bethany Hernandez, first year college from BSN 1T. So, for today, I'm going to demonstrate to you the transferring of patient from bed to wheelchair and wheelchair to bed. But first, we need to introduce ourselves to our patient and verify his name. So, good day ma'am. I'm your student nurse for today. May I ask what is your name?
Yes, I'm Vanessa Joy.
Kailan po kayo pinanganak?
16th of September,
Ilang taon na po kayo?
17.
Okay. So after that, we need to prepare all the procedure, all the equipments that we will be needing. So the equipments that we will be needing are a rope or appropriate clothing, a slippers or shoes that is non-skid, also a transfer or walking belt, a chair or a wheelchair, and a sliding board if necessary. So next, we need to explain to the client what we're going to do and why it is necessary. So good day ma'am, for today we're going to transfer you to your wheelchair. Is that okay to you?
Yes.
Okay. So after that, we need to provide hand hygiene. So the rationale of this is for us to avoid the spreading of microorganisms or the cross-contaminations among patients or clients or vice versa. Next, we need to provide for client privacy. Close the door and close the curtains. So, before transferring, we need to assess to the clients the following. First, the client's body size, the ability to follow the instruction, activity tolerance, muscle strength, joint mobility, presence of paralysis, level of comfort, and presence of orthostatic hypotensions. So, now we will proceed in the procedure. So now we need to position our equipments appropriately. First, we need to lower the bed at its lowest position so that the client's feet will rest on the floor, then lock the wheel of the bed. Then next, we need to place our wheelchair parallel to the bed as close as possible. Then put beside the bed the wheelchair. Then lock the wheel of the wheelchair. Next, we need to proceed in preparing and assisting our client. First, we need to assess the client in sitting position on the side of the bed. So, ma'am, ngayon po, kailangan niyo po umupo po sa gilid po ng kama ninyo and i-assist ko po kayo. And magbibilang po ako ng 1, 2, 3 and slowly po, babangon po kayo and uupo po kayo sa gilid po ng kama ninyo. Okay po ba yan? Okay. So, ma'am, nakaramdam po ba kayo ng pananakit ng ulo or mga sakit po nung bumangon po kayo?
No.
Okay. Now, we need to assess our client in putting the bathrobe if necessary and the non-skid slippers or shoes to our patients. So before we proceed in the next procedure, as a nurse, we need to position properly or correctly, and we need to stand directly in front of our patient. So the rationale of this is to help and to prevent the loss of balance during the transfer of our patient. So next, we need to give or instruct explicit instruction to our patient. So first, we need to move forward and sit them on the edge of the bed. So the rationale of this is to bring the client center of gravity closer to the nurse. So next, the client should put her hands on the bed surface or on the shoulder of the nurse. So for her to push herself while standing. So the rationale of this is to provide additional force for movement and to reduce the potential of strain on the back of the nurse. And also, the client should not grasp the neck of the nurse, doing to support while standing. Doing so can injure the neck of the nurse. So ma'am, kailangan niyo po mag-move forward konti and i-assist ko po kayo, okay? So ngayon naman po, dahan-dahan po kayong tatayo and i-assist ko po kayo ulit. Tapos magbibilang po ako ng 1, 2, 3 and slowly dun po kayo tatayo. Okay po ba yun? Okay. 1, 2, 3. Okay. So after that, we need to assist our patient to stand up and move together toward the wheelchair. So next, we need to assist our patient or client to sit slowly on the wheelchair. After that, we need to ensure the safety of our patient. So first, we need to move backward our patient on the wheelchair. Then lower the foot plates. Then put the feet of our patient there. And then apply or put the seat belt of the wheelchair in our patient. Kailangan po natin mag-move ng dahan-dahan. And magbibilang po ako ng 1, 2, 3 and dahan-dahan po kayong umupo. 1, 2. Okay. So now, in transferring the patient from wheelchair to bed, first we need to put the wheelchair beside the bed as closely as possible, then lock the wheels of the wheelchair. So next, we need to position properly ourselves, position correctly in the patient, and stand straight directly in front of the patient. Next, we need to ask to our patient if she can move a little bit forward to the wheelchair. So the rationale of this is for the patient to move closer to the nurse. So next, the patient's hand should be in the shoulder of the nurse for her to push herself while standing. And then so the rationale of this is to provide additional force for the movement and to reduce the potential of some strain to the nurse. Also, the client should not grasp the neck of the nurse, So, to avoid some neck injuries for the nurse. So, ma'am, slowly po, tatayo po kayo sa wheelchair po ninyo, and slowly po, tatayo po kayo, and then lilipat po, uupo po kayo sa gilid po ng bed nyo, and i-assist ko po kayo. So, magbibilang po ako ng 1, 2, 3, and then dahan-dahan po kayong tatayo. Okay? 1, 2, 3. Okay, so dahan-dahan po kayo maglakad, and slowly po, magbibilang po ako ng 1, 2, 3, and dahan-dahan po kayo uupo. 1, 2, 3. Okay. So, do you feel any pain po nung tumayo po ba kayo? Nakaramdam po ba kayo ng pagkahilo? No. Okay. So next, we need to assist our patient to stand slowly and move together toward the bed, and assist her also to sit slowly in the edge or the side of the bed. Then carefully assist the client to slowly lay in the bed, and then we need to ensure his safety and comfortability in her bed. So, ma'am, slowly po, hihiga po kayo sa bed niyo ng dahan-dahan. So, ma'am, nakaramdam po ba kayo ng any pagkahilo po or pananakit po?
No.
Humiga po kayo. Okay. Comfortable naman po ba kayo?
Yes.
Okay. So, after that, we need to document all the data or information that we've gathered in our patient. Okay. So, that's how I demonstrate to you the transferring of patient from wheelchair to bed.